Couples who have tried to conceive for a year with regular timed intercourse should seek fertility evaluation. Now that's for women under the age of 38. For those over the age of 38, they should seek a fertility evaluation sooner, typically after 6 months. So a fertility specialist is actually called a reproductive endocrinologist, and it's an individual that's done 3 additional years of subspecialty training beyond their 4 years of OBGYN training. And they specialize in the use of hormonal injections and the creation of embryos in the laboratory. That's what separates a reproductive endocrinologist from a general gynecologist. It's an intimate and long journey, and you have to pick the right doctor. So I always encourage patients to interview their doctor and make sure they're comfortable with the care they're receiving. The term IVF stands for in vitro fertilization. It actually means one thing. It means the fertilization of an egg in a lab. But today when we use the term IVF, we're really talking about the whole cycle, a whole series of procedures that culminates in the production of an embryo. IVF success rates are very much aligned to the age of the egg provider. Women in their 30s see birth rates of about 50% per embryo transfer, whereas women in their early 40s, the rate's about 25%. And that's really for women up to about age 43, 44. Beyond that, it's really very low. And so age is a big indicator of IVF success. The other major factor is the quality of the IVF lab and the personnel working in that lab. Those are called embryologists. So skilled embryologists and labs that focus on gentle approaches to embryos really can have an impact on the overall success rate of the IVF cycle. The side effects related to IVF are actually quite minimal. Women can feel a little local irritation from the injectable hormones. It's a small needle that's used to inject the hormones in the fat under the abdominal wall. Women also feel a little tired and bloated and might have some weight gain during the hormonal injections, but that weight gain typically goes away after the procedure is finished. The greatest risk for IVF is multiple pregnancies, and that's because to accommodate the decline in egg quality, we transfer more than one embryo, especially to women over 35 and over 40. One new method that can help limit the chance for twins or triplets is called preimplantation genetic screening, also known as preimplantation genetic diagnosis, PGS or PGD. In this procedure, we grow the embryos till they're 5 days old and then take some cells out of the embryo and test those cells to see if the embryo is chromosomally normal. We also find out if it's a boy or girl. And so we can replace or transfer one embryo that's chromosomally normal and therefore essentially eliminate the risk for twins or higher order pregnancies. It's very effective and very accurate.